A phased array transducer is used to evaluate lung sliding as an extension of the EFAST exam. The orientation marker is positioned in the direction of the patient's head. The transducer is placed in a long axis orientation over the anterior chest wall at the third or fourth intercostal space in the anterior axillary or mid-clavicular line. A superficial scanning depth is used. The ribs are identified in the near field of the image as a bright interface with a posterior shadow. The pleural line is identified as a bright hyperechoic line between the rib shadows. The normal to and fro sliding movement of the visceral pleural against the parietal pleural with breathing generates the lung sliding sign. If desired, the delineation of the lung sliding interface may be enhanced by changing to a linear array transducer.